This is Emily. Emily is suffering from agoraphobia, the fear of having panic attacks in public places. Emily's agoraphobia has gotten so bad that she is now afraid of leaving her house. After one panic attack, her friend recommended her to go see a psychiatrist.
Oh god, oh god. Oh, okay, we have to get out of here. We have to go. Come on, we have to go. Oh, alright, where's the exit? Calm down. We have to get out of here. I need to get out of here right now. I need to get out of here.
Getting out of hand. You need to go see a therapist.
So the next day, Emily made an appointment with a recommended therapist.
Hi.
Hi. You're Jamodia?
Yeah, hi.
Hi, I'm here for my appointment.
Okay, well, come on in. How have you been feeling?
Alright.
Alright, so I understand you're here because of your panic attacks?
Yeah, they happen when I'm in public. There are a few places where I'm alright to go. They're for the most part pretty close to my house, and if I leave these places, like I don't feel comfortable. I get really nervous, and sometimes, well, like you said, I get panic attacks.
Well, people with your disorder are... Agoraphobia is the fear of having panic attacks in public places. So, with panic disorder, there's three parts to it, right? There is your actual panic attacks, and then you have their anticipated anxiety, which is when you're always anxious of when you're going to get these panic attacks. And from that, you get your agoraphobia, so you're never sure when you're going to get these panic attacks. So that's why you're not going to go out into public places where it's not going to be easy to get help, right? So that's why you're scared of all these, of going into public.
All of these unfamiliar places. All of these unfamiliar places are kind of outside of my comfort zone.
Yeah. So first, what we're gonna do is I'm gonna treat your panic attacks, and I can give you some anti-panic medicine, so some anti-anxiety drugs to see if that'll work for you.
Okay.
And I'm gonna prescribe you some Ativan. So this will help you with your panic attacks. Ativan. Ativan. That's gonna help you with your panic attacks, and just also remember that whenever you're out in public and you're about to have a panic attack, remember to tell yourself that you'll get through this. So.
Okay.
Yeah, that'll be all for today.
Okay.
Emily used the strategies that Jamodia told her to use, and it began to help her more.
It can't kill you. It's not going to kill you. It's not going to kill you. It's not going to kill you. It's not going to... Oh my god!
With minimal improvement, Emily came back to see Jamodia 5 weeks later.
Hi!
Let's go sit down.
Okay.
Okay, yeah, so where should I go?
Emily goes back and tells her therapist that even though she is less anxious when she is outside, she is still experiencing panic attacks, so some of her agoraphobic symptoms are still evident. Though Emily realizes that panic attacks aren't fatal, since her medication hasn't worked for her panic attacks yet, she still somewhat fears public places. Her therapist reminds her that even though her cognitive therapy is working, it does not work instantaneously and needs more time. However, since her anti-anxiety medication seems to not be working to prevent her panic attacks, Emily's therapist prescribed some MAOIs in addition to the Ativan.
With the new drugs that she was prescribed, Emily was able to avoid her panic attacks in public. Thank you.
Can't kill you. Can't kill you. I'm alright.
As time passed by, Emily continued to go to her therapy sessions, took her medication, and changed her way of viewing her fear of panic attacks in public. Her agoraphobia eventually went away, and now Emily is a healthy person living her life phobia-free.